Prescribing errors continue to be a major problem in the U.S. healthcare system, but there is a tool developed by the business community that enables providers of medical care to determine how well their system alerts users to common yet serious prescribing errors. Welcome to the Clinicians Roundtable on ReachMD, XM Channel 157, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter for the Chicago Tribune, and with me today is Leah Binder. She's the Chief Executive Officer of the Leapfrog Group. The Leapfrog Group uses the leverage of some of the nation's largest employers to initiate breakthrough changes in medical care safety and quality. Ms. Binder is a former hospital executive who worked as Vice President of Franklin Community Health Network based in Farmington, Maine. Prior to that, she served as Senior Policy Advisor to New York City Mayor Rudolph Giuliani, where she developed programs to improve care of the uninsured, among other projects. She began her career in health policy with the National League for Nursing, where she served as Public Policy Director. Leah Binder, welcome to ReachMD.
It's great to be here.
Well, I want to thank you for being here and congratulate you on what is still your new job at the Leapfrog Group. And I know that you, having been involved in the provider community, you have some real insight on the ability of doctors and hospitals to contend with medical errors. And one of the more serious errors that we keep hearing about, although you're going to tell us about some momentum in that regard, is prescribing errors.
As someone who's been in the provider community, I'm not a provider per se, but I have certainly worked side by side with physicians and nurses and other providers and can say unequivocally that every single person who I have ever worked with in the hospital setting would like to eliminate medical errors and feels passionately about that. I think more than almost anyone else, if you're a clinician working at the bedside in an American hospital, you don't want to have to experience the tragedy of a medical error. You certainly don't want to make a medical error, and you don't want to talk to patients about a medical error that they have suffered. You would like to see them go away. So probably the most passionate proponents of good measures to eliminate medical errors are probably the people who are working at the bedside. So I am well aware of that. And the problem is that we have created a healthcare system and a financing system in healthcare that makes it very difficult for hospitals to put the kind of priority on patient safety that they need to. And priority is a big word that means not only that we think it's a priority, but also that we act as if it's a priority ahead of other things, and that we budget as if it's a priority and we spend money on it, et cetera. And those kinds of things are very difficult to do in a healthcare environment that doesn't always reward the right things, financially or otherwise. So what I think is very positive about the Leapfrog Group is that our goal is to really restructure the financing incentives over time to see an improvement so that we are rewarding the right things. We are recognizing the hospitals that take the steps that are necessary, and some of those are expensive, to improve patient safety and really put the priority on patient safety so we see those results. And we think that's something we should be doing in partnership with them.
And so with the physician order entry that you're going to talk about, tell us a little bit about that. I mean, that's been around for a while, but if you could get into your evaluation tool and how that works. And also, since you brought it up on the expense, I mean, is this something expensive that a provider would have to implement?
The cost that we charge for use of our tool is the time it takes to complete the Leapfrog survey, which is, most hospitals tell us, a day or two. But the tool itself, which is quite resource intensive to develop and very valuable to the hospitals we know that have used it, is free for anyone who completes our survey. Computerized physician order entry there's a whole variety of different kinds of CPOE systems, but essentially they are computerized systems for managing the prescription ordering and fulfillment within a hospital setting. And there have been some very good studies that have demonstrated that hospitals that use a CPOE system have anywhere from 50 to 100% reduction in medication errors. So we're seeing very big payoff in terms of safety and quality, and probably cost, although that hasn't been as well established, but certainly it would stand to reason that there would be a reduction in the cost of care if the system is implemented properly. And then that word properly is very important. The Leapfrog Group and our researchers have deemed that the evidence around CPOE is so dramatic that we have included it as one of the most important elements of the survey that we conduct of hospitals every year. So we do ask hospitals in our survey to report whether they have a CPOE system. And then this year, the tool that you're referring to is we have introduced an evaluation tool to evaluate the effectiveness and accuracy of your CPOE system. So for those hospitals reporting that they have a CPOE system, they can use this tool to report on its accuracy. And what hospitals have found that we have talked to who have piloted this tool is that they are surprised at the fact that sometimes their CPOE system does not work the way it should.
And that's very interesting because some of these hospitals are spending a lot of money, perhaps millions of dollars on electronic systems. And I guess what you're talking about here is that they might not be working so well, despite the fact that they bought something that, they spent a lot of money on.
Right, and I think they may be working better than not having them at all. In fact, they probably are. But they still need to be continually improved and refined because they are subject, like everything else in the world, to human error. So let me just tell you how it might work in a hospital and then what happens to break it down. So a physician would have perhaps a handheld device and would order a prescription for a particular patient in the hospital. That prescription then goes into the system, and if the system would match the prescription with the patient's record, and if there's an allergy interaction or if the dosage seems out of line, the system is supposed to send a message back to the physician with an alert, which the physician then reads and either acts upon or overrules. So if the physician says, I know about that allergy, but it's not severe enough and for the risks, et cetera, so they overrule it. But at least they are alerted to this problem. And then it goes to the pharmacy. Pharmacy has the same opportunity to review interactions and other patient information, and then it's fulfilled at the bedside. So there's a number of points where the system will interact with providers before the medication is actually administered. And in addition, it will track when it is administered, how much is administered, and et cetera. So there's a way to track all of the medication a patient is getting. And you can see in thinking about all the points where errors could have happened, how easy it is for medication errors to happen in a hospital. So the system is meant to really catch those errors. So what happens, though, is that hospitals will implement this system, and then they customize it themselves for certain interactions that they want highlighted or not, where they want alerts to go, whether it's to the pharmacy or the physician, and how they want their system to be customized to their hospital. And that's where we find there are issues that the hospital administrators didn't know about.
Well, if you're just tuning in, or even if you're new to our channel, you're listening to the Clinicians Roundtable on ReachMD XM 157. I'm Bruce Japsen, the healthcare reporter with the Chicago Tribune, and with me today is Leah Binder. She's the Chief Executive Officer of the Leapfrog Group, represents some of the nation's largest employers, and we're talking about an issue that has been a big deal to employers, medical errors, and specifically we're talking about computerized physician order entry, and the Leapfrog Group has developed an evaluation tool in this regard on physician order entry. And Ms. Binder, if you would, there is a big payoff, is there not, when hospitals and doctors get together and they do this computerized physician order entry. If you could tell us a little bit about that, and also, since this has been talked about for so many years on computerized physician order entry, where are we? How is there a certain percentage that we're not doing it before, that are doing it now, and perhaps compared to 5 years ago, or what can you give our listeners on that?
6 years ago, when we first started asking about whether hospitals deployed a computerized physician order entry, we found about 2% reported having it, 2% of our reporting hospitals. Good news and bad news. Good news is 5 years later, we have an increase in prevalence of fivefold, so that's good news. The bad news is still only 10% of hospitals that report to Leapfrog are saying that they have a CPOE system. So progress, but a lot slower than we'd like. We'd like to see more hospitals deploy these systems, and I might say that for many hospitals, they are looking to deploy electronic medical records, and CPOE systems are typically part of that, which is great. But in the meantime, we strongly recommend that before you get your EMR, if the EMR is usually a very large undertaking for a hospital, start with a CPOE system, since the payoff for that is very, very substantial in reduction in medical errors. So that's why we are, strong advocates. When every hospital in the country has EMR, electronic medical records, we'll be thrilled, and we can take that question off our survey. But until then, obviously, we have a long way to go before we're going to see that level of compliance with our CPOE standard.
And to your point on that, when you're talking about to these hospitals, and with the doctors who are there and those who have implemented electronic medical records and computerized physician order entry, are they telling you how things have improved? I suppose a lot of times providers don't want to admit that they actually made some mistakes in the past. I mean, are they able to provide you or anyone else any measures that show that, oh my goodness, you know what, we issued X number of inaccurate prescriptions a few years ago and now we're not doing that at all? Have there been any ways to measure that at all?
Well, there have been some studies that have demonstrated that using CPOE can reduce medical errors by anywhere from 50 to 100%. The IOM did a study. There's been a number of studies that have looked at that, which is why we at Leapfrog decided that it was such an important standard for us. But what nobody's looked at, to our knowledge, and what we're the only ones asking about, is how the quality of the system that's deployed, how well it's working. And what we are finding, again, from our pilot is that there's mistakes and errors and ways that things are customized incorrectly. What we do in our tool to try to evaluate that is we give hospitals a set of dummy patients that they are to input into their system, and then we give them a list of medication orders that they enter, and they report on how that goes through their system and how that's reported and to whom. And then we get the results and we score them and give them feedback on how they did. And as I said, a lot of them were finding things that they just didn't know about. So, for example, some would find that in one case, any kind of alert that would say, for example, that there's an allergy interaction or this dosage just seems inaccurate, any kind of alert like that was going to the pharmacist, who was then supposed to track down the physician. The physicians had turned it off of their handheld instruments, so they didn't get the alerts directly. That's not a good way in terms of safety or efficiency or quality. It's in no way is that the best practice for how this should happen, and nobody in the hospital, or some people in the hospital, but certainly not many of the administrators, were not aware that this had happened. So there are certain things just in terms of protocols and how a system is deployed that hospitals themselves need to get a better handle on, and this tool was really helpful for them in doing that.
Well, with that, I would like to thank Leah Binder, who has been our guest. She's the Chief Executive Officer of the Leapfrog Group, and they've been doing a lot of work surrounding medical errors, and one of their later initiatives has been this computerized physician order entry evaluation tool. And for information about that, you're free to check out their website at www.leapfroggroup.org. I'm Bruce Japsen of the Chicago Tribune. I've been your host. To listen to our on-demand library, which includes this show, visit us at reachmd.com, register with promo code RADIO, and receive 6 months free streaming for your home or office. If you have comments or suggestions, please call us at 888-MD-XM-157. And I'd like to thank you today for listening.